Intake and screening process for volunteering at Toronto General Hospital, Toronto Western Hospital, and Princess Margaret Cancer Centre. Please keep in mind that the process to become a volunteer has several important steps and may take up to 4 to 6 weeks. This intake process was developed in order to best serve the patients and staff and potential volunteers at UHN. The first step of the screening process is to fill out an online application. The link for the online application will be revealed at the end of this presentation. You also need to download the reference form and have 2 professional references completed. Friends and family members are not considered professional references. Once completed, please keep these handy to submit during your interview. When you click on the link to download the forms, click Save and it will save to your computer. The link will be available at the end of this presentation. The next step is to wait to be contacted for an interview. Your application will be screened within 2 to 3 weeks of creating your online profile and submitting the application. Interview invitations will be emailed to successful candidates only. You have the opportunity to schedule your own interview online once contacted by Volunteer Resources. When you attend your interview, you will hand in the completed reference forms. Please do not have them emailed to Volunteer Resources. Successful applicants will receive a conditional offer of acceptance letter and a health immunization form that needs to be completed before they start volunteering. The next step is the one that can take the most time to be completed. All volunteer applicants are required to get a health immunization record completed. We need proof of immunity for measles, mumps, rubella, and chickenpox. A 2-step tuberculosis skin test also needs to be completed. There are many ways for you to get your health immunization record completed. A yellow Ontario immunization card, medical records from your doctor, past health records from an academic program or workplace. If you or your doctor do not have any past records, you can get a blood test done at your doctor or a walk-in clinic to determine your immunity. Please note, UHN does not reimburse any fees your physician may charge for this service. You will also need to undergo a 2-step tuberculosis skin test. Please visit your family doctor or a walk-in clinic. You will receive the first step in your forearm. You are required to go back to get it checked in 2 to 3 days. Then you must wait at least a week, but no longer than 3 weeks, to get the second test done in the other arm. You will need to go back and get the second test checked in 2 to 3 days. If you receive a positive test on either arm, you will be required to undergo a chest X-ray. When your health immunization records and TB tests are completed, make an appointment with Occupational Health and Safety so they can review your health records and give you clearance to start volunteering. Please make sure you bring your conditional offer of acceptance from the interview to the meeting with Occupational Health and Safety. Volunteer Resources will receive clearance confirmation from Occupational Health and Safety and will email you a volunteer orientation schedule. Next, you need to attend a mandatory orientation session as soon as possible to learn about UHN policies, procedures, and volunteer practices. 3 orientation dates are offered per month across the different hospitals. It is the same orientation content at each session, so please attend the one that best suits your availability. Placement and training. After the orientation session, a program coordinator will contact you to discuss your placement, finalize your schedule, start date, and complete your volunteer registration process. You will receive training by the staff in your placement area. Thank you for watching the online volunteer information session. Please click on the link to fill out an online application form. The password is UHN Volunteer 2014. Please enter the password on the application when prompted.